COVID cases are climbing again this summer. California, Nevada, and Arizona each saw a positivity rate of 12.5%.
Joining us now is Dr. David Bronstein, an infectious disease specialist with Kaiser Permanente Antelope Valley. Thank you so much for being with us this morning.
Morning.
Okay, I see all these fun little figurines behind you. You're also a pediatrician. We know a lot of kids are going back to school. Is that one of the factors that's involved in this rise, or is it just kind of a coincidence?
No, absolutely. Every time kids go back to school, we start seeing them swapping their germs, spreading infection. It's what we see in the wintertime when kids come back from winter break. Summertime is no different, especially with COVID. We've been seeing this pattern over the past few years where kids come back after a long summer break, after traveling in many cases. You put that together with the fact that we've got a highly contagious variant circulating right now, the Stratus variant you may have heard of. Put that all together, and the heat. People are in indoor places trying to escape the heat. Lots of good ways of transmitting the virus, and that's exactly what we're seeing with higher rates of infection, higher rates of clinic visits, and now emergency room visits, particularly for kids. Kids under 12 are making up quite a few of those ER visits.
Oh,
very interesting. I know it does feel like we're hearing a lot of people saying that they have COVID right now. How does this current wave compare to the previous ones, doctor?
It's pretty similar. I think now that we've been living with COVID for a while, we're starting to see this pattern. We know there's a late fall, winter surge or wave, and now we know that every year we seem to have a summer wave as well. Right now, the percent positive, that 12.5% that you mentioned, a little bit lower than last time at this year. Last August, it was around 18%. But it's still a little bit early. And when we look at the wastewater trends and see that early indicator of what's happening with COVID, we know that more is on the way, especially in the southwestern states here. We're getting hit particularly hard right now.
We know less people are getting vaccinated from the numbers. How do we address that, and how is that playing into the surge now?
So vaccination for sure is the safest and most effective way of preventing the illness, of making sure that the illness doesn't become more severe, preventing complications. There's still a very large role for vaccination. And so we strongly encourage that, not just for COVID, but also the flu vaccine. We now have that available in most places. And those who are eligible for RSV, that vaccine will be available as well. So vaccination is key. Right now, we're waiting on the official recommendations from the CDC in terms of when we can start vaccinating, also who the vaccine is recommended for this upcoming season. So more to come on that, but when the vaccine is available, it's really a perfect time to get it to protect you not just against the current wave of COVID, but also the upcoming winter one, which again, we see that every year as well.
And speaking of protection, besides the vaccine, what advice do you have for people as we head into the fall season to avoid catching this?
Well, especially with kids in school, I think if your kids are sick, please keep them home, right? If you've got a fever, if you've got the congestion, the cough, especially in the early stages of illness, do your part to protect those around you. And go ahead and stay home if you're sick. Same thing about going to work. Stay home from work if you're sick. So not exposing other people is absolutely essential. And when you are sick, if you do have to be out in public, wear a mask. I know it's not as popular as it once was, obviously, but it's still a very good way of not getting the virus and also not spreading the virus. So I would suggest wearing a mask if you need to.
I have plenty of hand sanitizer back in my car too, and I'm washing my hands. Dr. David Bronstein, thank you so much for being with us this morning.
Thank you.